As if the prediction markets like Kalshi can't feel more dystopian enough, you can now bet on whether or not a drug, right, like a pharmaceutical drug, makes it through FDA clinical trials, what day it reaches FDA approval. And I, as an economist who studies the pharmaceutical industry, I am just like, I don't even know what to say. So on July 16th, it was announced that Kalshi is partnering with Applied Excel, which tracks clinical trials, like at what stage they are at, so that now people can use that prediction market platform to bet on whether or not drugs make it through phase 3 clinical trials, which essentially is the last step before a drug reaches FDA approval and it's allowed to be sold to the public. Now, as of right now, it is very limited about what you can bet on these prediction markets. So early stage clinical trials and conditional approval cannot be bet on, and it's only limited to pharmaceutical companies that have market caps of over $500 million. So smaller boutique pharmaceutical companies, you're not allowed to bet on. And so some of the bets right now on Kalshi's platform are very interesting. So for example, there is a bet right now on an Alzheimer's drug that's being developed will meet the goals of its late stage clinical trial. There's also a bet about whether Eli Lilly's new weight loss drug it's developing will receive FDA approval. And as an economist, again, who studies the pharmaceutical industry, there are a lot of red flags about allowing individuals to bet on prediction markets. The first thing is a concern about insider trading. Now, Kalshi has said that it requires employment verification for traders, right? So if you work for Gilead or Eli Lilly or any of these other pharmaceutical companies, you cannot bet on whether or not there is a drug being developed and whether or not it will pass its stage 3 clinical trials. However, we know from recent examples that employment verification on these prediction markets has not been effective, right? It has not weeded out all of the individuals, which raises concerns about market manipulation and insider trading. And this market manipulation doesn't just have to happen with people who are working for that company, right? It can involve people who are involved in the clinical trials themselves, right? The doctors, the nurses, the patients, even if they are not employed by the pharmaceutical company, they have some insider knowledge that they could use to influence the prediction markets. The other big concern, right, from these prediction markets that allow for financial incentives within the decisions of these clinical trials is that people who are involved could alter or delay the decisions themselves, right? If somebody is betting on whether or not there's a cure for diabetes in 2028, well, maybe they delay their decision until 2028 if they've made that discovery in 2027. And how does that affect patients, right? The fact that they do not have access to the medications that are already developed but are being delayed due to market manipulation. It could also encourage people who are involved in a clinical trial to withdraw from a particular study if the betting odds for that particular clinical trial are low. There's just so much that could happen and be influenced by these prediction markets, showing what public opinion is for these clinical trials, especially if these bets are coming from people who don't have clinical expertise. Now, Kalshi states that this is actually a good thing. The fact that we have public knowledge about how we think these pharmaceutical clinical trials are going to go. And look, I know that these prediction markets, right, have seeped into a lot of American culture and American daily life, for better or for worse. But I feel like when human life and human health is at stake, it's taking it a bridge too far to allow for these prediction markets and the subsequent potential spillover effects of how it affects drug development. It's just a bit too much. For now, that's all I got. As always, if you have any questions, let me know.